Good evening, or welcome to this webinar that we are going to discuss today about winter injuries. Now, the weather has been atrocious, so I think this is going to be relevant to a lot of you. Winter injuries are such a challenge. So my name is Alice. I'm the director and founder of Award Equine Physio. We specialise in rehab and performance horses, and we have had lots of experience dealing with different injuries, different levels of ability of client, and getting those horses back on track and staying sound. This is a really tricky skill, and it's something that I am uber passionate about. That is because my warm blood was diagnosed with a career-ending injury at 4 years old. He's now 21. I fought everything and got him back. It took a long time, back sound and back in work. And that really inspired me to help others along their rehab journey. So I've been qualified for 14, nearly 15 years now in both human and equine physio. I pull a lot of my human training into the equine world, which can give quite a unique approach. And I don't accept, or the whole team doesn't accept anything as normal. We dig, we dive, we question everything, which can create a really good outcome for your horse, especially if they're complex. So today we are going to explore more about injuries, how you can prevent them, and kind of early signs and symptoms of things. I'm not going to go too deep, just so you can get a little bit of a viewpoint of all the different elements that you might encounter in winter and how to avoid these to the best of your ability. We believe knowledge is power, which is why we put on these webinars, because you as horse owners, if you have more knowledge, you can help your horses, and you are the eyes that see your horses every day. So you are a vital key component of the team. Sorry, I also have a cold, so isn't that a wonderful time of year? So winter is really tough, as we've said, for equestrians, but also really, really hard for the horses. We see a huge amount of increase in injuries during the winter months, which can be a huge blow both for you as an owner, but also a real big challenge for the horse. Winter can be really tough for horses. They don't always like bad weather. They might have ailments that they're struggling with, and winter just exacerbates them. They might not see as much of you as they normally do, and they might not get as much turnout, which we'll be touching on all of those points and ways that you can help your horse during the winter months. So PSD, so proximal suspensory desmitis. This is a humongous problem. I think diagnosis of this has got much better, which is why we're seeing an increase in diagnosis of PSD and the awareness around it. Now, if your horse gets diagnosed with PSD, don't panic. It's a really common ailment that many horses, especially sport horses, suffer with. It's chronic inflammation of the suspensories, so not necessarily a tear, but lots of inflammation, and where the suspensories run, there is not a lot of space around them. So what can happen is inflammation presses on nerves and can be very painful for them. So that can present as them not wanting to work. They might not be obviously lame, but they might not want to push forwards, they might not want to jump, they often lose their canter. So it's not always a lameness, it can just be a poor performance that can then lead to a diagnosis of PSD. Now, it's really important, if you notice any of those things, that you get your vet out quite quickly, because the earlier we can diagnose it, or the vets can diagnose it, the more manageable and treatable it will be. If we leave it too long, it gets quite nasty and quite complicated. So the suspensories run down the back legs, and the most common area of PSD is in the hind limbs. It can be both, or it can be one. So during winter months, if we think about the mud the variation in workload. This can cause abnormal loading to those very sensitive structures, overuse of them, and just general wear and tear of them. So when the workload drops, which is often the case in winter, we're not going out for those 4-hour hacks, we're not riding every day or 5 days a week, the weather's horrible, you don't want to get on. That's okay. However, your horse will become weaker and they're at higher risk of developing PSD. That alongside the sticky mud, the more time inside, this combined can be a beautiful recipe for proximal suspensory desmitis to kick in. So if you're suspecting that, the vet will do a workup of your horse. They might nerve block the horse and see if there's any improvement. Then it can lead to scans if they're all positive, and then potentially a diagnosis. So if they diagnose your horse has got PSD, they will normally, depends on the severity, but they'll recommend remedial shoeing, potentially shockwave, potentially laser, depending on your vet, as well as lots of physio. And I say this because a lot of PSD is caused by weakness. That's often how it comes back. So then the muscles become really weak, and then from there they develop PSD. So what do we need to do to sort that out? We need to get them strong again. And a really structured non-impact, so not picking up their legs over poles, that will just make them more angry, those suspensories. A really graduated program is critical. Even if they have a neurectomy and fasciotomy, which is the surgical option, the quicker we can start that static work, even pre-op, is crucial. We have worked with a beautiful pony called Paddy, and I've commissioned from his owner to share his story. So we actually saw Paddy for routine physio for quite a long time. She's a very conscientious owner. We saw him very regularly. She does all of the homework, but he's an older horse, and he was competing at elementary, and we were noticing he just didn't have the push in the medium trot, and that got worse and worse, and it flared up through winter. So we got the vet out, we had him assessed, and he was diagnosed with bilateral PSD. Now, with it more severe on one side. So he was remedially shod. I don't think he even had shockwave. He was just remedially shod. Work pulled back. We were really strict with his turnout. He needed to be turned out, but on really level fields with minimal mud. We kept him in long reining work, and we put in a static strength program. Now, fast forward 8 months, he is now back to being Paddy. He's 20 years old, so it was a bit of a we were fighting against his body a little bit at times, but through consistent progression and the owner's dedication, we have now got him back, and we're just having to manage him through the winter months to make sure he's kept in consistent work, he is kept strong, and he has his turnout, and he is currently sailing through winter. So there is hope out there. So even if your horse has been diagnosed with it, it's just to be aware that actually we need to keep all of these elements in place. So the other thing, another issue that we often see in winter is a flare-up of arthritis. Now, I know with my body, in the wet and cold weather, my joints hurt more, especially my joints I know are arthritic. Now, that is the same for the horses. So if they've been diagnosed with arthritis, especially hock, neck, back, you are going to potentially see that exacerbate during the winter months. Now, that is due to the weather. We can do nothing about that, but we can keep them warm with rugs, make sure they're really well rugged and they're not allowed to get wet or too wet, because that can make them really cold. We can make sure we keep them moving. So we have to do maximal turnout on really good ground where possible. We want to avoid days in the stable. And we need to minimal mud, because the more they work and aggravate those joints in the mud and slip around, that the higher risk we are of both injury and aggravating arthritis. And if they are struggling, despite all of these things you put in place, consistent workload, you need to seek the support of your vet. Vets are there to help you. And we're always frightened to give our horses anti-inflammatories. Now, I know if my joints hurt, I take some paracetamol. It doesn't stop me doing anything. I don't panic about it, but we're really cautious with horses. Now, if your vet has said there is no reason you can't, and your horse is struggling, give them some anti-inflammatories, as long as you're also putting that management in place for them to move as much as possible, to keep them well exercised on a gentle routine. So don't ever worry about giving them anti-inflammatories as long as you're doing the management alongside. The other thing we often see during winter is soft tissue strains. So slipping and sliding can result in strains or sprains of ligaments, tendons, and muscles. So this is something we see commonly, an acute tear. So that means it's not a chronic overuse, it's a tear. They can be very lame because of it. So obviously seek your vet, first of all, if your horse is presenting lame or with a really hot patch with swelling, whether that's on the leg or the body. And how can we prevent that? Well, we can't stop them being trollops in the field, no, but we can keep them in regular work, keeps their brain maybe slightly more mellow, but it keeps them strong and supple. And I think one thing to bear in mind, if your horse is slipping and sliding around a field, the stronger and more supple they are, the more they're going to be able to rectify that slip or that slide before an injury happens. So when you're thinking about the strength work that you might be putting in place or the suppleness work that you're doing, it's to prevent those injuries that otherwise might be a real problem. The other thing to bear in mind, especially with soft tissues, is the warm up and cool down that you do with your horse. So when you're in winter, it's cold, it's wet, or it's cold and or wet. Your horse's blood flow is going to be less around its body, same as us. We get, chilblains, takes us a lot longer to warm up if we are going to do exercise, and it's the same for your horse, especially if they've been standing in their stable all day and or all night. So you need to really make sure that your warm up and cool down is creme de la creme. We need to have them bending and stretching. You need to do it progressively. So you don't just walk, trot and canter. That is not a warm up. You need to know your horse's limitations. Are they stiff or are they weak, or are they both? Or do you need to focus on one thing more than another thing? And make sure that you spend as much time thinking about your warm up and cool down, especially during the winter months, as you do your actual ridden session. You'll find your ridden session is actually much more effective in the middle, and it might be able to be much shorter. But then don't finish your session because it's pouring with rain and chuck them in their stable. No, you need to let them stretch. You need to let their body cool down. This helps with the repair of any micro tears that happen during your ridden session. So really focus on warm up and cool down and keep them in work. So SI, so sacroiliac issues. Now, this is something we see as physios a lot. They end up coming to us often before vet, but is quite often a secondary issue, which means it's not the primary problem due to weakness or another biomechanical issue. It is rarely the main problem, but occasionally a slip or slide can overstretch the sacroiliac joint and cause those little ligaments and muscles around it to overstretch, which can cause a lot of pain and discomfort. Now, the sacroiliac joint is not like a hip joint. A hip joint, ball and socket, really secure. The sacroiliac joint is literally two bones touching, which is supported by ligaments and muscles. Again, this is why it's so important to keep your horses really strong, because it supports those little joints like the sacroiliac joint. So yeah, be aware that if your horse is just not feeling quite right, sometimes they can be very lame with a sacroiliac issue, or they can just feel like they're just dropping one side of the pelvis or not pushing as much when you're bending them one way. That can be a bit of a sign that you might have a little issue with your horse's sacroiliac. They might find rein back, so backing up, quite difficult, or might tuck their bottoms right underneath and stand with their feet underneath them. Now, if you've got a physio that knows your horse well, they'll know your horse is normal, so then they can see if there's any changes to that. And if you are really worried, it's best to have a vet look at them, because they know what they're looking at. They know if it's higher, lower, and can really help you along that journey of working out what's wrong. So they're kind of 4 main key issues that you might experience during winter. I'm really hoping you don't, but just to be aware of those ailments that you might experience. Obviously, there's a whole host of other things. Feel free to reach out to us if you've got, if you're noticing certain things and you just want a bit of guidance. Normally we say go to your vet. Now that is because your vet is the expert in lameness. We are not able to diagnose lameness, and actually often we see horses, we end up sending them to the vet. So yeah, get your vet involved if you are worried. They can help you with management, they can speak to your physio, and it's a really useful, your vet is there to help you. Don't be scared to ring them. Now, one thing I really wanted to touch on was box rest. Now, when I say box rest, I'm kind of referring to they're not allowed out of the stable. Now, normally that is for an injury, but it also can be, you've got no turnout, you can't ride. To me, that is deemed box rest. It's far from ideal, but there are certain times or certain injuries that require box rest. And it's a really, really tricky time. We advocate for as much movement as possible. Like I say, there are some times where injuries happen, your yard is covered in ice, you're not able to leave the stable. Those kind of things that if you move them, it's at high risk. So if you are in that situation, here are a few ways that you can help your horse through that process. It's very stressful, them staying in a box all day. They're not designed to, they're designed to roam miles. So the first one is static strength work. Now, I've spoken about that a little bit. This can be really suitable for horses with an injury, providing your vet is happy with it. Obviously, if it's a forelimb injury, we don't want to be weight shifting them front necessarily early on. But there's lots of things you can do with the hind limb as well to keep the hind strong, which can help forelimb injuries. So static strength work is moving them around in certain places with them standing still. So it's a bit like us doing yoga and activating certain muscles or lifting weights in certain ways. We're not necessarily doing big dynamic movements like jumping on a box or running. We are doing really isolated movements that really focus on a specific area. This can really help your horse. It can give them something to think about. It can reduce the risk of significant weakness occurring during box rest. But like I say, if your horse got an injury, you need to consult with your vet first, just to make sure they're happy with you doing that. We have some lovely online programs that can talk you through step by step how to do all of this, because it's not a widely practiced thing in the equine world. The next thing is actually just spending time with you. That might sound like a really silly thing, but we're busy people. Often the questions are rush in, rush out, the horse is done. But actually just spending 5 minutes with your horse in the stable can be a really lovely moment of time down for you, as well as bond building with your horse, just listening to kind of what they're saying, what their body is telling you. So that is a really nice little exercise that doesn't take any skill. It just means you just got to isolate your focus on your horse for that short amount of time. Okay, stretching. Now, stretching we don't widely advise, because often we end up stretching really weak horses, which can result in weaker horses. But box rest is an exception. If your horse is on box rest, is not moving or can't get out in the field, then some sideways stretches with a lick can be really helpful. We avoid using tip bits because they tend to snatch around. We like a really graduated stretch round, as you would if you were stretching, not a snatchy stretch, and hold it there. And that's where the lick is brilliant. You might get covered in molasses, but the horse will be in cloud nine. Mental stimulation, this is something that we maybe don't talk about enough with horses. They're clever animals sometimes, unless they're spooking at leaves, but we need to give them something to think about while they're in the stable, especially if they're a sports horse that has got an injury and they previously were really fit and now they're on box rest and they're kind of going a bit wild. Actually, we need to give them something to think about. And that can be foraging, so you can hide carrots and hay nets. It sounds very simple, but it gives them something to think about. You can get lots of different toys for the stable, and that's a really good system of you need to stimulate their brains for them to not lose their mind during box rest. They may still, but grooming is really simple. So yeah, they're on in the stable, there's no mud in sight. Wonderful. However, grooming has a lot of benefits. You will increase blood flow while you're grooming them. You will get to know their bodies a bit better if you're just taking the time to groom them. Most horses really enjoy it. And it's a really nice both relationship building, but it's also really good for them physically, like I say, to get the blood flow going. You'll be able to see, they're getting more reactive actually through their backs. They're getting a bit tight, which you otherwise maybe wouldn't know. So yeah, that's a really nice, simple exercise, but often missed when a horse is on box rest. Time with their friends. There's more and more research out there about the importance of socialization with horses. And if horses are on box rest, they're often quite socially isolated. So even if they've got a field buddy or another horse they're really friendly with, letting them groom each other over the door if it's safe to do so, or being able to see another horse very close by or touch noses, it's a really important thing that we're understanding more and more about how important that element is. So it's worth bearing in mind where your horse might be stabled during the time they're on box rest. Now, the other element that, again, we don't talk about much in the UK is variable feeding heights. Lots of people believe feeding off the floor is really important. I agree. But feeding at different heights in the stable, the floor, you've got a hay net halfway up, you've got a hay net really high, imitates what they do in the wild. And it can be really good for neck mobility. And you can actually get them to really reach round and, move their bodies in places they may not otherwise do if they're just eating off the floor. They have to stabilize themselves when they're doing that. So they'll be activating little micro muscles through their postural support system as well. If you just change, give them little hay nets all around the stable at various heights. Obviously, you wouldn't want to put a low hay net, but off the floor, halfway up around, where they've got to reach round, is really, really healthy for them. And it's something we really advocate, especially for horses that have neck pain. But even if your horse is on box rest, I think I would highly recommend trying that one. It keeps them busy as well. Anytime they're on box rest, even if it's for reasons like you can't get out the stable, they're on box rest for, they're stuck in their stable for 3 to 4 days. When you ride them again, bring them back into work slowly. So it's not like chuck the tack on, make them work hard. That's kind of like you sitting down for 4 days and then asked to run. Bring them back into work really, really slowly. If they have had an injury, bringing them back into work progressively, but tapered to their condition, is also quite fundamental to an optimal recovery on the other side. To me, walking for 5 minutes one week, 10 minutes the next week is not good enough. There is so many other elements to rehab that are not discussed, and most owners don't know about, that I'm really passionate about sharing. So yeah, if your horse has had any injuries, get in touch, because we would love to help you get your horse back to health and stay sound, because that's the critical thing. You don't want to be revisiting box rest and vet intervention. You want them to become sound and stay sound for as long as possible. So let's wrap this one up. Key takeaways about winter and winter injuries. And you might have got some of these through this webinar. You need to try and keep them in consistent work through the winter months as much as possible. Even if this is in-hand work or long reining, we need to try and keep them in consistent work. It will help keep their bodies in good shape, keep them strong, keep them supple, and that massively reduces the risk of injury. So yes, time off is important, but it needs to be very structured time off and then taper back into work and stay in work. And I think we're all quite good in winter at going, oh, it's a bit wet, I won't ride. But actually, sometimes our horses need to stay in work for their bodies. Know your horse's baseline. So if you don't know how your horse normally moves, how do you know if they're not quite right? Might feel they're not quite right, but how many of you have done little circles either way in hand, or seen how they do a rein back, or have a baseline of a trot up, or have a gait analysis baseline for them? I would really recommend that you know your horse's baseline, because every horse is slightly different. They're not all symmetrical. This is where professionals also come in, because they can monitor your horse through the winter months and pick up on these injuries really, really early on. Don't get lax with a farrier or any other professionals because it's winter and your horse isn't in as much work. So I often hear, oh, you know, I'll push the farrier back a week. They've not really done a lot, but then their feet are looking slightly long. Their posture's gone a bit poor, which means that those suspensories, oh, it makes me. So keep up with your professionals during the winter months. They will also help keep you accountable and help adjust your schedule with your workload. So especially your physio or body worker will be able to help you adjust your workload according to what your capability with time is. They'll pick up on those injuries really early, and we want to prevent as much as possible. So do your best to have maximal turnout. I know that is really tricky. It depends where you are in the country. It depends what type of ground you're on. What you don't want is your horse wallowing around in knee-high mud. However, you want your horse to be able to move around freely as much as possible. I know that's a tall order, but even if you're able to turn out in the school for an hour in the morning and an hour in the afternoon, it no way replaces the field. However, it does allow them to stretch their legs and get that lymphatic system moving, help with their circulation and their brain. But they're looking at social licensing coming into play, and potentially horses will have to have access to turnout all year round. So do your best to have the best turnout for as long as possible through winter months. Monitor your horse closely, like we said, through grooming and taking time to feel their bodies maybe before you get on. If you're worried about any changes, then please, you need to get in touch with your vet or your physio or whoever's involved with your horse really early on. Don't leave it too late, but monitor your horse closely through those winter months. All it takes is one slip and slide in the field and they can feel not quite right. And if you're not monitoring them, you may not notice. Or if you've given them 4 days off, you might not notice. So make sure your team are also there to support you. Have a team around you that you feel you can turn to, you can ask questions. They understand your horse's requirements and your requirements. Make sure you have a cohesive team. Having a horse is hard and they're challenging creatures. So make sure you've got a really good support system. Good warm up and cool down, That's also critical through winter. And I don't mean mincing around in a long rain and on your phone, like a really structured warm up and cool down. I'm hoping to do another video just about that at some point, because I think it is really critical for riders to understand the warm up and cool down process and what is needed. And don't hesitate to get your professionals involved. Ring them, ask them. They are there to help you get through winter. I hope you've all enjoyed this, and I will see you on the next one.